For massive weight loss, typical is breast and belly. Get rid of the extra belly skin, breast skin and tissue sometimes because some of the breast tissue is going to just hang low.
COVID did good things, but it also did bad things for burnout because there's people that got totally burnt out because they got overworked.
A lot of the younger generation are happy doing what they do on screens.
But it's going to keep people healthier and alive and maybe creating more kids.
The population is getting older, so they're going to require even more care. So you're just going to have like this exponential change of decrease in the number of physicians.
When I would lift, my chest would get bigger. I didn't realize it until I was in plastics that it was gynecomastia that I had.
One drink at like 9 p.m., it's like, good luck.
Welcome to Doctor's Life Podcast. I am Dr. Rozbeh here with my brother,
Dr. Radbeh, where we discuss issues in health, medicine, and lifestyle from a doctor's perspective.
We're board certified plastic surgeons, and mainly we're going to discuss how plastic surgery is run from a business perspective and how we got here.
So what are we talking about today? I just got back from my trip.
Yeah, so let's hear about your trip. How many monkeys did you see?
Oh, it was actually a lot. They were running all over the balconies. So just came back from Costa Rica. It's a nice little relaxing trip. The travel kind of beats you up because you got to drive to the airport.
Did you fly into San Jose or Liberia?
No, Liberia. And it was still 2 hours away from Liberia just because getting out of the city is on like one lane road. But yeah, Ari loved it because there were monkeys on everybody's balconies. Like we're obviously not supposed to feed them, but she was just like trying to run to the market to get like some plantains and small bananas to feed the monkeys. So she was happy with that.
You guys got rain the whole time.
Yeah, it's a rainforest. You know, everybody complains about that. It's like the sun pops out, you get sun, you get some beautiful sunsets. Obviously, the last time we went was crazy rain.
Yeah.
This time wasn't as bad. So we got to do a few things. Took a boat out and like the whole it was a big wedding party. I think for a destination wedding, I usually associate destination weddings with like I don't know, a handful of people, 20 people max. I think there were like 50 to 70 people here. Yeah. So it was fun. I personally never do the all-inclusive resorts.
Yeah.
So I like to do a little more exploring, but like it's just so easy when everything's there. You just
How was the food?
It was pretty good. It wasn't as good as obviously last time when we had the chef like making all that good stuff, fresh seafood, and like it's just a different level when you guys going down to the fishing port, making us food, fresh fruit, stuff like that. But it's still really good. I'm not going to complain about it. I showed you that burn. I think we got hit by a jellyfish jumping in the water.
Yeah.
The boat took us out to this island. Everybody like jumped off and was like jumping off the top of the boat. Nobody realized it until later on. We're like, we got these marks on our body. Like, it's like I didn't touch anything hot. It can't be that. But yeah.
Or was there an eel? Like an electric eel?
I think I would have felt that more. I don't know. Yeah. Like it was almost everybody with like I didn't know. I thought it was just me. And when I brought it up, somebody's like, oh, I got this mark on my shoulder, this mark on my back. Yeah, it's a good segue into wellness for preventing burnout. You know, physician burnout rate's been over 50% in the last 2-3 years of numbers of physicians claim they've had burnout. And during residency, I was always the type saying like, I can't believe these people are complaining about burnout. Like they trained for this. And then like within a couple of years out, I was starting to feel it because it's just feeling underappreciated kind of. I think that's where it stems from. And it's not like, oh, you don't have grateful patients or something. Yeah. It's just like something was missing and I was working a lot of hours. So I think it was that combination of being tired and feeling underappreciated. How about you?
You get into the grind and sometimes you forget and you just work. Yeah. And you don't notice it. And like when you're burnout, you almost don't notice it until it's like too late. Yeah. You almost need an intervention to be able to figure it out.
Yeah.
I think COVID did good things, but it also did bad things for burnout because there's other hospital people that got totally burnt out because they got overworked. And now it's, decreased amount of physicians, more amount of, the population grows and less physicians out there.
The demographic changes too. The population is getting older, so they're going to require even more care. So you're just going to have like this exponential change of decrease in the number of physicians.
Yeah, I've always, I've tried to take a big part in the hospital and letting people know about burnout, and like, because I've lost friends to like suicide from a lot of this burnout stuff, and it's not good. It's not fun, and you've worked so hard for so long in your life, and like
just physician suicide rates been on the up. Like it's just like when you see the numbers, and
like suicide, divorce, like all this stuff like that physicians go through is like, people think like, oh, they're just like a cash ATM machine once they finish.
Yeah.
And I think where you don't get as burnt out in residency is you get to leave it, in the residency. Although you could claim your patients and take ownership, it's still, you get to go home, when you're in practice,
it's not the ultimate ownership of the patients.
Your patient's still seeing you in 6 months, a year, 2 years, 3 years, it's so that occurs. And then, with,
you can always say, oh, I'm just the resident. So.
With the way insurance are too, you're not even getting compensated for it, and you're having to work more hours to be able to bring in what you think you're supposed to bring in. With plastics, it's great because we can do a lot of things. We have our cash pay patients.
Yeah.
If you want to do, we can do a lot of mission work. And then you got your reconstructive options. Taking calls just became horrible, and like it's more busy work, and you don't get sleep, which I think puts on a lot. Not just sleep, getting good sleep, like sleeping through the night with being on call. I think it's a big part of burnout, and all the stress that you take on for so many years being in medicine. I think also like got to get your cortisol checked, because I think most people is like screwed up. Like I take adrenal gland daily because like I know because drinking coffee, taking energy drinks, and just like putting your body through that stress day in, day out, and getting battered during, residency and med school and everything. I bet you like if you check hormone levels on physicians, it's probably shot. Like everyone's is like low, and
you're running on empty pretty much 24/7. And it just messes up the whole cycle, like daily layer.
Where your lab results might be normal, although they're on the low level, they might read as normal. But like if you know what you're doing, you can get yourself to a better place with that. But a lot of it's, I think, sleep and diet are going to be huge for physicians, to stay out of burnout. Like good night's rest. Before, like a lot of people said, like 4 or 5 hours of sleep. And I'm like, I'll sleep when I die, working. And now I'm like, all right, my son's going to bed and he's going to fall asleep. I'm fine falling asleep at 8, 9 o'clock. I'll wake up at 5, start working out, doing my stuff.
So it's like, it's taking care of yourself. Sleep, exercise definitely helps. Decreasing alcohol will definitely help. And no matter what, because that'll just help with getting more sleep and exercise. Other things that help me out, having those structured dates off, because I would say, okay, I'll mark my calendar off when I'm ready to take time off.
Yeah.
And like that first year, I wasn't really doing that. I went like 9, 10 months in a row. And so then I decided after that, and how bad I felt, it was like when I got Ari's school schedule, I was like, there you go. 1 week, at least 1 week during summer break, 1 week during fall, winter, and spring break. So I at least had those set dates, and then long weekend here and there. Like I still don't think that's much overall if you think about it. If you're going like really hard, working 60, 80 hours a week and then just taking 4 weeks off.
Yeah.
It's still probably should take more time than that, but I'm getting better about that.
I think the other thing you got to do, rather than just vacation, I think to be better mindset is, and you just think about things differently, is daily meditation, daily meditation. And it doesn't have to be 20 minutes. You could do 5 minutes, 10 minutes of breath work, and do it 2 or 3 times a day if you can. I think helps out tremendously. When I don't get on that schedule, even when I do it once a day, I totally feel the difference between doing it once to 3 times a day. with the way I feel, the way I function, you just totally feel differently. So I think just better mental focus.
So there was an article I just skimmed through from JAMA Open Network, and it showed that they did a trial, and the physicians with peer coaching had way less burnout, like 30%. I want to say like 80% did not have burnout. And I did some program like that, like about a year and a half ago, because it was a friend of ours, and that's related more towards like professional growth and athletes and stuff. But I was like, this sounds pretty good. I'm going to try it. And I did one session with them, and I can definitely see the benefits. It's like just talking through with not just a coach, but like a group setting.
Yeah.
So I thought that was good. And this seemed like similar to that type of program, to like, not just start in residency, they have wellness activities and stuff, but to see what really helps you out, even if it's in the slightest bit, or you don't want to admit you're burnt out. Like if these little things that help you out, you should consider like continuing them, because you've done some self-help stuff, whether it's books, right?
Well, yeah, like what this gets me to think about is like habits that you build, and that like kind of almost get you into a bad place too, is, like as physicians, we like to help people, and like that's all we care about is like, and you get into this habit, you're like, no, I got to do it for this patient. And then it becomes the next patient and the next patient. Then you're not going home. You're not seeing your kids. You're not seeing your wife. And you're not getting the oxytocin release if you're not getting hugs from your wife or your kids. And, that's going to like mess up your whole outlook in life. And like, you're just going to, and it continues like day after day. And the patients don't know. That's kind of like, even driving to the hospital, like, the hospitals try to push you for first case starts and stuff. I get up early, but like, I want to see my kid. So, I'm like, if I'm 5 minutes late, as long as I get to see my kid before I go, and I'm not going to drive extra fast to get into the hospital, I'm like, I don't care about a first case start I'm like, if you want to start me at 9 o'clock, fine. I'm still going to be late to that, just
well, sometimes it's not like all the time. Like I love dropping Ari off at school. Like that's one of my favorite things that I was never able to do during residency for 6 years. It was like maybe like a couple times a year. Yeah. Now it's like, okay, on my clinic days, if I'm not starting till like 8:30, 8:45, I can drop her off at school and then make it to clinic.
Or case canceled. Like last week, case canceled. I'm like, yep, don't push up my cases. I'm going and dropping my son off.
There you go. You got enough work when you don't mind the little case cancellation here and there.
Yeah. Yeah.
A little bit of time off. Unexpected is really nice. What else? I mean, we say meditation, like a lot of people like, what? You don't need to necessarily formally meditate. Like there's different types of meditation, right? If people pray, that's a type of meditation. If you read, paint, color, there's all different.
The thing is you gotta, your mind's just gotta be zeroed out, and I think that's the biggest part, just like and like once you really get into it, it's a different state. You can't because even if you paint and stuff, you're still thinking. I know you could be in another world doing it.
I'll stand on the other side, because I've gone in the zone with like painting or using markers, and my mind is just like when I meditate, maybe even like just complete reset. And I don't know, it helps. Some people get stressed out painting because you're like trying to execute something and something goes wrong. So people, like I'm saying, for certain people, certain activities can give you that state of mind.
Yeah, like some people, the habits going to the gym and they get, they get endorphins and they get the rush by doing that, so there's different ways to put out your energy.
Exactly. So it's like activities you like, you got to prioritize
not
them.
drinking alcohol.
That we can always come back to that.
That's not good energy. So
we can always come back to that.
Yeah.
That just been shown to.
Well, you shouldn't go back to it ever, but
no. I mean, say like it just adds anxiety, crushes your sleep, and that all adds up to like just horrible daily patterns can be very self-destructive. And it's not even like that many drinks, like one drink at like 9 p.m. It's like, good luck.
Yeah.
Especially if you're in your 40s or something, maybe your body's can fight through it earlier on, but like the older you get, the more you're going to feel off of it as far as negative side effects.
One thing that came up, I was reading about in my emails from ASPS was how young is too young to get a facelift.
It's tough. I think it's individualized. People have different types of, whether especially right now with weight loss and decreased like fat components or descending fat compartments in your face, you're going to see it earlier, especially with more weight loss. And it's also patient expectation and individual differences. So I think it's younger and younger. What were they saying? Usually it used to be in the procedure to get done in your 60s.
Yeah, when I first started out, if someone in their 40s or like early 50s came, I'm like, yeah, maybe in another 10 years, you might need it. Although in Arizona, it's younger because of the sun damaged skin. But now, like for the best results with what people are looking for, you're going to get the best results at a younger age, at 30s and 40s, where the elasticities in the skin and what you're doing, everything you're doing with a facelift, what we do, like some other people just try to pull on the skin.
Yeah.
It's building the structure underneath, reshaping the structures that are underneath, not just pulling on the skin where you get that Joker look or something.
And the skin can gain elasticity, and one or two bad facelifts, by the time you're 60, you are going to look a little funny. But if you get the deeper structures that have the strength, then you're going to get longer lasting results. It's going to look more natural too. I think that's one big thing is like shifting quite a bit in plastic surgeries. People want more natural look. Well, some people, not when it comes to butts, apparently.
Well, no, even that's changing. But yeah, if you're placing the fat back to where it belongs and where it did look, or where it was when they were like in their 20s or like in their teens or like early 30s. So you're just taking the fat, moving it around, releasing some of the ligaments and reattaching it in new places to be able to get that look. And then you remove a small amount of skin. It's not much skin.
Yeah,
removal.
It really isn't at all. It's funny. It's like you're expecting to, even like older patients in their 60s and 70s, you're expecting to remove much, and you're like, oh no, it doesn't take much.
What I can't understand is all these people that are, doing 10 cc's of like hyaluronic, like Juvederm or any sort of filler. And like, they're like minimally invasive facelift. And I'm like, yeah, how long is it lasting? It's not even lasting 2 years. And you're paying all this money for putting all this synthetic stuff in your face.
Yeah. Cause if you're getting 10 cc's, like 2 sessions, it's pretty much going to possibly pay for it.
And then they're doing skin tightening and stuff. And then you got all this scar tissue for a facelift. Not that we can't do it. It just creates a mess when it, and are you going to do that every 2 years? You're going to go in for like this $10,000-$15,000 non or minimally invasive facelift. I'm like, yeah, they look great, but how long does it last? Well,
they say 2 years, right? If you do it repeatedly, you can build an immune response, right? And your body like crushes it. Like it's sometimes like 6 months to 12 months.
Yeah. And the treatment's got to be tailored to you, and like they're using, how many times are they going to be able to use radio frequency on your skin to get that like tightness? After the first time you do it, maybe they can do it 1 or 2 more times. If you get a facelift, you get 10 to 15 years out of it if you get a good facelift, and it's got to be tailored to you. Like some people have a lot of skin laxity, and like the ways to do it is you got to move the structures around, give them the youthful look back. And then a lot of times you do need some external device to, tighten up the skin even further to give them the best possible.
But you're
look.
not saying tighten it up surgically as that follow-up. So it's like combination facelift with just skin treatments.
Yeah, skin treatment. There's like radio frequency. I like the Renuvian, either external or internal on the face. There's the Croton peel, or some of the deeper chemical peels that you can get. You have to be under anesthesia to get them. but they have some amazing results. But most of them look better than all these like $300,000 lasers that people are using. So
yeah, I would say that. And another thing I always talk to patients that come in to discuss facelifts and stuff is facial fat grafting. Because with like 50 mLs to 100 mLs, you're going to get such a drastic change. Because you keep mentioning about moving the structures around. Part of that's replacing the fat where it belongs.
Yeah, and you got to be very careful with fat grafting. Once you put once you reposition their fat pads and everything, you really don't need that much fat.
Well, I'm saying like 50 cc's, 100 cc's, you're going to get like wide areas of the forehead, brows, periorbital areas, cheekbones, potentially nose, nasolabial folds.
Yeah, especially with Ozempic now, like a lot of people don't want to undergo a facelift, although I recommend that as the first choice. But if they don't want to do it, you can inject fat to rebuild that structure. Or you can
combine the two.
But it never overfill, just do the appropriate amount just to make it look natural, because overfilling, then once you go to reposition, it's going to, once they get the facelift, it's going to look horrible.
It's just going to look weird because there's just fat and where
But the good part about fat is you're going to also induce collagen building within the skin. So it rejuvenates the skin as well. So the thing about the BBLs, like people want bigger butts, that's actually changing around too in certain places. We probably don't see it in Arizona. Arizona is not as big of a BBL place, although, we got a Mexican crowd, but it's still not that as big as you go to Texas or like New York, the East Coast is like full of it. We don't get as much of it here. Maybe Vegas gets it, but we do quite a bit of it. But overall, I don't think
the numbers wise in the state it's not that popular of a procedure in this state.
Yeah, I think we do more breast dogs and facelifts than anything else. Like rhinos aren't big here, and BBLs aren't big.
Yeah.
Those are two things we do a lot. So, but like even then there's talks about there's physicians coming out reversing BBLs, because we've had it, a lot of places you go to, especially these chop shops, that they're just like everyone gets the same bill, no matter, they don't really listen to you. Someone sold you a package to get a BBL and they're like, all right, we suck it out with these huge cannulas and then they shove it back in. So sometimes you're like, all right, that's not the butt I was looking for, but you don't get to quite choose. And that's when you go to these cheaper places that are doing them for $4,500 or $5,000, and you're not getting any post-op care. You're not getting pre-op care. You get what they, what you paid for.
You get your 1 day.
Yeah, you get your 2-hour BBL. The other thing that's great with Ozempic, the whole Ozempic thing, for us, it's great business. You can get patients the medication, but we're also getting a lot of people coming in, especially male patients coming in after massive weight loss just on Ozempic. And, they've been working out hard. Now they have all this excess skin to remove. So what types of procedures are guys coming in for?
For massive weight loss, typical is usually breast and belly.
Yeah.
Get rid of the extra belly skin, breast skin and tissue sometimes, because some of the breast tissue is going to just hang low, and some breast tissue might be,
I don't know,
I forget
what you're looking for.
The breast tissue it's stagnant. Like you'll sometimes lose like some of the fatty tissue, but your breast tissue is going to stay there. There's all different procedures, and it matters like how bad the areas are. Other areas could be the arms, lower body lifts. Lower body lifts, I think, is like an underappreciated procedure, and we're going to be performing more of them throughout the next few years.
And it's important, for male body contouring to for you to go to someone that understands what they're doing and is able to give you what you want. So you don't want someone that does a lot of females and doesn't know how to do men. You want someone that, knows how to do both, because one thing is, liposuction. And like I saw someone today that, had an abdominoplasty, and the it was a very feminine looking abdominoplasty. I'm like,
do you think there was lipo involved too, or it was just the approach?
I don't know how much lipo was. I think part of it's the approach, where possibly where the incision
patterns,
was.
Probably,
yeah. And also you got to look at the belly button too, a male belly button versus female belly button, what you're going to do to create that. I think that's important.
Difference.
Yeah. And then the lipo portion's probably a big portion of it too.
How do you differ your lipo for men versus women? Is there certain areas you hit more or less, or certain like visual cues in a male body that is different than a female body?
The love handles are a big part of the guys that you want to hit. Like in females, you can empty that out with liposuction, but you got to be very careful. It's like a wedge area, where in the male, you kind of go almost to the upper portion of the butt, and you're emptying out like over the gluteus medius, that's more lateral. That's usually the area you want to kind of take only a little bit, because you're going to fat graft kind of the trochanteric dip to kind of smoothen that out in females.
It's the side hip.
Yeah.
The hip dips people call.
In males, you want a more muscular look. So you want to bring out what the muscles look like. So
not like an hourglass shape.
Yeah, the lower body lift with the breast is a big thing these days that I've been doing on quite a bit of men. Again, they've done all this hard work getting down in the weight, and especially, like they start with Ozempic and then it gets them more active and they start working out, and we're able to, give them their bodies back, because they have to tuck it in, even tucking in, like it looks weird. You never want to take off your shirt. Like going to the gym becomes hard because, guys aren't used to wearing Spanx and stuff, and I'd rather be naked. So I don't like wearing clothes. So it's like, it's tough, like when you got the overhanging skin and stuff. Yeah. And I've had the issues myself. So like I kind of discuss it with the patients. Somehow my chest, my gyno, it appears more now as I've aged because it just hangs off the pec muscle, but it sort of looks like the male aesthetic chest. And that's what kind of confused me when I was a kid, because, when I would lift, my chest would get bigger, but, my gynecomastia was probably getting bigger.
Yeah.
And I was like, all right, I didn't realize it until I was in plastics that it was gynecomastia that I had. And
so what was the most you ever benched?
You were there for it. Yeah. So
was it 425?
425, yeah.
That was a good one.
Yeah.
Have we talked about that?
No.
Yeah, Rue's like, come and spot me. And you were in what, like sophomore year college?
Yeah, and it was in a small little dormitory gym.
Yeah, small dorm gym. And at that time, I only weighed like 160 pounds, or at least that was the weight class I was at. And he's asking me, he's like, come spot me for this bench press. I'm like, just looking at the bar bending and how many plates he's got on there, I'm like, that's 425 pounds. It was like, if you drop that on your chest, there's nothing I'm going to be able to do for you. And your response was classic. You think there's any way I'm going to drop this on my chest? Just get over there and stand there. I'm like, okay, here we go.
Yeah.
It's a crazy amount of weight.
Because I was playing football and all I did was like bench and squats.
Bench and squats, that's it. Now it's everybody's trio they're going for is bench, squats, and deadlifts.
Yeah.
I don't know, you use the resistance bands a lot, and I got to get better with it, but like it's so much nicer on the joints, and like I can't imagine like going crazy like deadlifting or squatting a lot of weight. Yeah, I mean even bench press, like the most I ever did was, I think it was 295, but like I was trying to get 315 to have like 3 bars on each side. I went to do like a set of 3 at 275, and the shoulder just put me out. And after that, it was just like, I don't need to put up 315 pounds. That was in my 20s. So now in my 40s, if I try to do that, my arm will probably like just fall off.
Yeah.
I'm just tailoring workouts for what fits my body best.
Yeah.
I don't want to like the regular aches and pains either. So what do you do for aches and pains?
It's gotten a lot better since, I've been on tirzepatide.
Since you got the weight down?
Yeah, and the weight down. The shoulder, I was trying to gain more shoulder mobility, and that kind of screwed things up a little bit. I think I broke through some scar tissue in my deltoid or something, or outstretched my, I'm like, is that my pec muscle? Is that... But, like using the resistance band, it doesn't hurt. And it just hurts, it would hurt with certain movements. but it's kind of gone away. I use different things. You know, I use like glycinate to go to for sleep, but it also is a natural muscle relaxant. I use a newer supplement I heard about, PEA. It's this formula by Sunbalance, and I take it before sleep. And that actually helps me get into deeper sleep. And I think it helps to decrease swelling. So it's going to decrease pain and stuff you're going to have with it too.
Okay.
And along with that, also, I take a blend of BPC and KPV that's going to decrease the inflammation in my bowels. So
do you stay on BPC and KPV?
No, I cycle through it. So if I go on vacation, I'll take it after that. Or if, you know, like
for how long?
In a few days, I have a dental procedure, so I have to get on amoxicillin. So too bad I'm taking it right now. I usually do a 30-day cycle every quarter or so. I do BPC, KPV, and then I also add lorazepam to it because I think lorazepam's great along with that. It's like your gut balm. You take that. I think it clears out my system. I just wholeheartedly feel a lot better with my gut. You just feel clean.
Gotcha.
If you're on hormone replacement and everything, like once you clear out your gut, like you're like your hormones and everything, you can tell like everything's like maximized and optimized. Yep. So to a much better level.
Stretches, specific exercise. Used to have bad neck pain.
Yeah, I used that pivot therapy thing. I found some great pillows that kind of provide traction on the neck when you sleep. And it's slight traction. It's not crazy. It's the company's Canuta. And I bought some of their like other traction devices that you can actually like take naps in.
Okay.
But they're not made for longer periods of time because they're kind of like the pivot therapy. They're a little, but they're not as hard or as much traction as that. I don't know. I just bought this pillow, the Sleep Nest. So I'm going to try that.
Sleep on.
Well, like the other, you know, you got to change up your pillows because they wear out. They do get the foam ones. They get soft, and I think like one of them wore out. I had two, so I started using the other one, and then Sleep Nest. You know, I bought because I think both of them are kind of wearing out to kind of get something new. Not that I'm having any neck pain. It's just to continue on the good path.
That makes sense. I think another thing people like habitually do not stay on top of is replacing mattresses. Yeah. We're not, I mean, thank God Sarah stays on top of it, but like if it was just me, I'd probably have the same mattress for like 20 years.
Well, my mattress is supposed to last 30 years, so I paid quite a bit for it. So I don't think that one's going to get changed.
We've been changing every like 4 to 6 years, I want to say. Maybe like a little sooner than that with a couple of them. Just because they just didn't feel right. It's just like, if you're not comfortable, again, getting back to sleep, like you want to optimize that.
But it's kind of bad because like whenever like go to hotels and they have nice mattresses and we're like, we just can't get comfortable because ours is so
hard.
Nice.
It's so hard. Like even the hotel we were at, it's just like, it's such a coin toss. You're like, what am I going to be sleeping on? And then like, it's just going to take a couple nights for your body to get used to it. You're just like, okay, I kind of got used to it. Like the first night we were at that resort, it's just like, I was up every hour. I was just like, this is such a pain. But got a little better each night.
So what did you think? I sent you the reel. There's, I guess Sony's coming out with a microsurgery robot.
I didn't look at it.
That could be good for your neck.
Well, we used that Rozbeh for a little bit. I like that posture.
Yeah.
I honestly, if I just do yoga and the pivot tools, even if it's once a week for like 10, 20 minutes, I'm fine. It's just I get lazy with it. And then I'm like, oh, now it's acting up. Okay. And I'll start doing some stuff.
You know, like when I can, I'll, you know, get up and go and just lay on that as soon as I wake up at 5 instead of like just rolling around.
That's not a bad move. Yeah, might as well like just get up.
I wake up. Active. Yeah, I put my headset, with the brain tap on, or use the Muse, either one, and just lay on there.
Oh, you asked about the robot. Oh, yeah, never mind. Go ahead.
Do you got more about the robot?
No, I don't. I'm comfortable using my hands. If the robot sets up fast, I would love to use a robot. I love using the Da Vinci when we were in general surgery. That's the most common used robot now. Just gives you like so much fine control. And makes it more like a video game. It's better for, I think the robot personally is better when you got like deep places to get, and we're pretty superficial.
But it's going to provide stability. It looks like it provides good stability where you don't have the shakiness and stuff, because you got to have the patient positioned right.
Even the robots now, they take out the shaky and stuff, and you can change the ratio, right? So like you can have 1-to-1 motion or like 3-to-1.
Yeah.
So like you have to move your whole hand like that much to get like that bit of a twist. So I guess some people find that beneficial.
So what do you think of this whole vote mess, election 2024?
I think it's way too early in our podcast to talk about it.
We won't get political with it.
No.
But it's a total mess.
We're going to have, democracy. If you say anything, somebody's going to hate you, and with all their heart.
So semaglutide's correlation with fertility, how do you think that's taken effect?
The mechanism of GLP-1s and increased fertility.
Yeah.
People are lighter, more attractive, and you get better hormone balance when you don't have all that excess fat helping turn things into burning and turning testosterone into estrogen and stuff has got to help too.
Yeah.
I think it's just probably all of that combined. I wouldn't think it's just one.
Yeah, and it builds self-confidence too. And it's anti-inflammatory. And like even like if it's reversing some of the vascular changes to your heart or brain, it's going to change the vascular changes to your penis too. So that's,
that is true
for erectile dysfunction. You're going to.
You don't know how much damage also to all your tissue and blood vessels you have from like the extra glucose riding on the blood cells.
Yeah. And if people are losing 15% of their body fat, that buried penis syndrome that you deal with being obese, that,
pops out of the woods.
That's going to go away. But, sometimes it doesn't go fully away until you remove the penis or that excess skin down there. And what we can do is like kind of release the tendon or ligament that's holding the penis back or retracted while we do a tummy tuck to kind of give them increased length and size.
Yeah, and the main thing is like during training, it's getting the weight off first before you try to do it, or else you're just doing surgery for the sake of doing surgery.
So like I had been reading recent years about how like the population growth's going in reverse, but maybe this will be good for the population growth and increase the population growth.
It could be. A lot of that population growth is also, I don't know, people put the blame on tech and screens and stuff. That definitely is going to contribute to it.
Yeah.
But a lot of the younger generation are happy doing what they do on screens.
But it's going to keep people healthier and alive and like maybe creating more kids.
And more fertile years. That's true.
Current hot topics we can't really talk about other than just Kamala Harris.
Madness. It's been absolute madness. And it's just goes to show you how frail everything is. And you're just like, God, I can be on edge about all of this. Like whether with the shooting and then rumors circulating that Biden's not even alive. Show your face. This is just crazy. See, I think it's just everybody's on edge, and it's going to be this way until the election. And who knows? Hopefully, it just ends at the election. It's going to be.
We thought they made it a circus last time.
I know it's getting worse every time.
It's going to be built into a reality TV show pretty soon.
It'll be more normal if it was a reality TV show.
Oh, that's the thing I was going to ask you.
What's up?
So Costa Rica, our friend Simran wrote, like, was there an earthquake there? And then I started researching it.
Oh, my God.
Earthquakes almost every day.
Is there? This was bad.
Was it?
Yeah. We were just hanging out all day. And, well, where I was, it was bad. Sarah and Ari were going to stay down and watch the fire show, which is pretty fun, actually. They actually did some crazy stuff. Because at first I thought they were just going to hold up flames and dance, because they did something like that at the zoo close by, and the guy kept dropping the stick, and I was expecting something like that, but it was a little higher quality. But I'm like, I'm going to go take a nap. And I went upstairs, and it just felt like the bed shaking, and it got worse and worse. I was like, holy crap, this is how it ends. I was just like, there's no way I'm sleeping now. I was just like wired. And I ran down, and they were obviously next to the pool and stuff. I'm like, what earthquake? I'm like, are you serious? I was like, there's no way. And like the group text, the other people at the resort were like, no, it was definitely, what the hell is that? And we looked it up. It was like an earthquake. I think the epicenter was in Guatemala. So it wasn't too far away.
So you guys, it seems like Guatemala, when you look at the map, it seems like it's pretty far away to affect, but I know it was a pretty strong one.
Yeah, it was like over a 6. It was a 6.2 earthquake. And they said some areas even as far down as South America felt it.
Oh, shit.
So it was pretty sizable quake. I was just like, oh God, like that at that point I was also like right away, like, get me out of here. And now I've been getting like anxiety getting on planes too. So I'm like,
yeah, I didn't know that. Yeah. They're like, yeah, they have like little shimmers every day in Costa Rica. It's like funny. Like if you read about it, not funny, but.
And yeah, I mean, as long as everything's like built structurally sound in a certain way, for seismic areas, because like I know like Mexico City gets a ton, so that's why Mexico City doesn't have too many skyscrapers, but they have a couple really tall ones, and they're like supposedly like can withstand like some crazy seismic shifts. So yeah, that was fun. I forgot about that completely.
Yeah, I meant to ask you that.
Oh, it scared the crap out of me. It was so bad. Well, that's a wrap. You can check us out on our socials or YouTube and visit our website for more information on procedures.
If you have any questions that you want to be answered, just DM us.
Or write them down in the comments.